afternoon, ladies and gentlemen. First of all, I would like to thank the organizers and especially Enrico Bergamaschi and Anna Salvati to inviting us and supporting our presentation. I am pleased to do this presentation on behalf of my colleagues working in the French Institute for Public Health Surveillance. So, before starting this presentation, I think it will be useful to present you some particularities we have in France regarding regulation on nanosciences and nanotoxicologies. So, after the release of 2 official reports alerting on possible risk for human health, the government decided to put in place some actions and officially charged the French Institute for Public Health Surveillance to assess the feasibility of an epidemiological surveillance system of workers occupationally exposed to engineered nanomaterials. By the meantime, the think tank put in place, which name is Grenelle of Environment, or Grenelle de l'Environnement, which released the first Grenelle law in 2009. And this law stated on the necessity of the public debate on governance issues for nanosciences and nanotechnologies, for the mandatory reporting scheme of engineered nanomaterials put on the market in France, for the improvement on information on risk and protection measurements, and the methodology for assessing risk and benefits. So last year, in February, we had 2 ministerial orders creating this mandatory scheme of annual declaration of engineered nanomaterials used, produced, or distributed in France. And in August, they were the application arrêté published, which precedes the conditions of declaration and items to be declared. So just several words about this mandatory annual declaration, because it is a very important tool for do some epidemiology and public health surveillance. It is in application since the 1st of January this year. It is operated via secured online procedure, which is managed by the French Agency of Safety of Food, Environmental and Work, ANSES. So it speaks about nanoparticulate substances, which are engineered nanomaterials defined globally based on the European definition of engineered nanomaterials. Who should declare the usage or production of engineered nanomaterials in France? All people who are manufacturers or producers, importers to France, and distributors of these materials. And the threshold for the declaration is 100 grams. So there is a long list of items to be declared. Again, it is a mandatory annual declaration. So the declarants have to describe their identity and also describe all characteristics listed on the slide regarding the nanoparticulate substances, including the shapes, particle size, aggregation, agglomeration state, specific surface area, and so on. Also, the quantity annually handled should be declared, as well as usages and downstream users. So, the French project of the engineered nanomaterials exposure and health effect surveillance is targeted on workers which are likely to be exposed during the production or incorporation of powders of nano objects, including their aggregates and agglomerates. We targeted first 2 nano objects of primary interest, which are carbon nanotubes and titanium dioxide, and our surveillance system will be articulated around an exposure registry and a prospective cohort of the exposed workers. So just several words about what does the registry mean. The registry is the system of ongoing registrations of data, which might be focused either on the particulate exposure or on a health outcome. So, and the aim of the register is registry is to constructing a register, which is a file of data, which should be related to a population based in an exhaustive manner. So the French multi-company engineered nanomaterial exposure registry will consist of an individual registration of the workers potentially exposed to engineered nanomaterials, for which we will determine the potential of their exposure to these materials, and at the beginning of the building of our surveillance system, we should be exhaustive in terms of exposed workforce on a company level before becoming exhaustive on the national level. So I would like to try to show you the approach that we developed to construct this registry. It is a multi-level and multi-step approach. We considered 3 different levels of intervention. So these levels are company, workstation, and worker. And to each level are associated specific methods, actions, and expected deliverable. And I will summarize them. So the first action is to create a list of company a priori using or producing ENM. Before the declaration will produce all available data and useful data, so it just started. So this list will be developed based on the public reports, professional networks, scientific literature, and after further updated and completed with a mandatory declaration. So we prepared the company questionnaire, which should help us to determine the type of exposure, to focus our 2 nanomaterials, which are titanium and carbon nanotubes. This questionnaire will be sent to the pre-selected list of companies, and using this questionnaire we will also identify the company contact person with which we will manage the interviews and in situ company visits. So the aim of this action is to identify the workstation at highest risk of exposure to engineered nanomaterials and to assess the exposure by constructing specific job exposure matrices. It would be company-specific exposure assessment with the help of industrial hygienists. And from these specific job exposure matrices, we will abstract the list of the workstation with the highest potential of exposure or with a reliable potential of exposure. From the human resource department, or from the director of the company, we will ask to abstract the file of workers affiliated to these nano-exposed workstations. And after, we will act on the individual worker level. So to all these workers, we will send the registry inclusion questionnaire with individual information and consent form to inform them about our surveillance system building. And after that, there will be some items also to assess individual particularities of workers' exposure. So all the responding workers will be registered, and further follow-up will be ongoing after with systematic data collection and updating through the questionnaires, but also through the company contact person. So it will enable us to maintain to complete systematically the health and exposure databases linked to our nano-exposed workers. So we have 3 different tools to assess the exposure in this survey. As I said, it will be a company questionnaire. Sorry.
Ladies and gentlemen, the next session in the non-Hashek auditorium will be postponed to 10 past 2. The other session is remaining the same. Thank you.
Well, I hope I will have time to finish. Well, sorry for this. The second tool is the specific job exposure matrices, and the important thing I have to underline here that in our institute we are no tools, no instrument, no devices to measure exposure, so we have some collaboration with the expert in nanometrology, with the institute like INRIS, CEA, in ENRS to do this work with us. The aim of the job exposure matrices, again, is to assess the likelihood of exposure in the beginning of the surveillance building, and after go deeper and deeper to have a quantitative exposure assessment with metrology, of course. And for the individual data on exposure, and we will reconstruct all occupational history through the questionnaire and ask the workers to describe in details their activity, especially those activity which involves nanomaterial handling. So, and of course, the availability and their attitudes towards personal protective equipments. So, this registry is conceived to be integrated in the global integrated system of the public health surveillance and also of the research. That is why we abstract all necessary information to put it in all existing databases, which are, for example, different job exposure matrices, and all occupation will be encoded using international standard classifications. So now I will present you the final layout of our system. It starts with our registry and continue with two occupational cohorts, a cohort for titanium exposed workers and carbon nanotube exposed workers. So the registry will allow us to do some simple AP surveillance and descriptive statistics, but it is also provided for the general prospective follow-up. That means that from single exposure we can study all different outcomes, not only diseases or fatal issues, but also different biomarkers, different early health effects. So the information on prevalence and incidence of diseases will be produced by questionnaires, but also by linkage with existing databases such as National Healthcare and Drug Prescription Database or hospital discharge summaries, but also, of course, and unfortunately, from causes and deaths register for the long-term follow-up. And on the other hand, all useful information will be abstracted from generic job exposure matrices, which are all managed by our institute. So, in the frame of the brown framework frame are included all the actions for which our institute has abilities, and in blue arrows are represented actions of collaboration which are possible, and we are very open and willing to have some collaboration, especially in the area of measurement of and metrology of the nano exposure, and of course studies of biomarkers as it was presented by Enrico, and of course all studies, all epidemiological studies with specific research objectives which are open to the research team, and further to the international collaborative studies as suggested and preconized by the roadmap. So I thank you for your attention. Just one word on the project agenda. We submitted the protocol which is validated by the ministry to the ethical protection authorities. We have the first one and we are waiting for the second one. We have our agreements already signed with some institute, and other agreements are ongoing. So we should start after the approvals obtaining, and we expect, based on the feasibility study results, to get something about 1,500 workers by 2015. So I thank you very much for your attention.
Thank you, Irina, for this very interesting talk.